CASERS team, in partnership with international medical organization, Médecins du Monde France, has implemented a project aimed to restore access to comprehensive healthcare services for vulnerable populations in frontline communities. Over the course of 11 months, 6 new telemedicine centers were established in Kherson and Mykolaiv regions. These centers are now operating in the villages of Sahaidachne, Tamaryne, Shyroke, Suvore, Tsentralne, and Kherson City. The project team transformed empty premises in local communities into fully equipped telemedicine centers, furnished with modern medical equipment. Medical staff received specialized training how to use modern telemedicine technologies. As a result, nurses in frontline communities gained new tools for their work, while patients have the opportunity to consult with specialists quickly and free of charge, without traveling to major cities.
The key issue is accessibility to the healthcare service in rural areas. And considering that the villages here are quite isolated, with limited or no proper transportation infrastructure, we believe that telemedicine resolves many of these major logistical and medical challenges.
The project team maintained regular and stable communication with telemedicine center staff. Administrators provided technical and operational support, while experts offered mentorship and communication materials. Both individual and group meetings were held to exchange experiences and review progress.
We created a system that works regardless of the security situation. In the areas where we established telemedicine centers, there is a shortage of medical staff, especially doctors, and particularly specialists such as neurologists, endocrinologists, and cardiologists. For many people, it is almost impossible to access such consultations in their own community or even at a functioning district hospital. They often have to travel up to 200 kilometers just to see a specialist.
The work of telemedicine centers is complemented by mobile medical teams, ensuring early diagnosis and disease prevention. During the project, specialists including ultrasound doctors, ophthalmologists, gynecologists, cardiologists, and others, covering nearly 15 medical fields, visited remote frontline villages.
The lack of medical staff, limited financial resources among rural populations, and even the absence of transport connections between villages and regional centers, all of this creates barriers. Telemedicine helps overcome these challenges by making use of the resources already available within communities.
Telemedicine enables both young and experienced medical professionals to develop their skills without leaving their communities, helping to reduce the outflow of healthcare workers from frontline and deoccupied areas. Over the course of the project, more than 3,000 consultations were conducted. More than 1,800 patients received medical assistance. As part of the telemedicine training program, 12 local healthcare workers were trained. The project also established cooperation with hospitals across Ukraine. Specialists from Rivne, Chernivtsi, Khmelnytsky, Kremenets, and other cities were involved in providing remote consultations.
The decision to scale up telemedicine centers was driven by positive feedback from beneficiaries, their satisfaction with the services, and the growing number of visits to the centers, as well as strong feedback from healthcare workers and PHC directors. Their feedback was essential for scaling up telemedicine centers.
Telemedicine centers have created space for patients to be heard, through feedback boxes and a dedicated hotline, for questions, concerns, and words of gratitude. Despite the war, constant risks, and uncertainty, these centers continue to operate. They keep healthcare where it matters most, close to people, within reach, even in the most challenging conditions.